Hi, Dr. White. How are you doing today?
I'm doing well, Radell. How are you doing?
Good. It's awesome seeing you, and I'm so
Thank you for
excited.
having me here.
Absolutely. And I know we talked a little bit before, so I'm really excited to learn more about you today and also just share your thoughts with anybody listening online as well.
Sounds great.
So I thought it would be nice, because I know we know each other a little bit, but if you could share a little bit about your history, how you became to do what the work that you do today, and a little bit of your specializations.
Okay. Well, first and foremost, I'm an obstetrician gynecologist. That was kind of my first passion, my first love. Then I got into infertility and reproductive endocrinology. Loved that. And then I started to see like the downside of infertility and just the cost, the emotional toil, just the expenditures, just physically, emotionally, and that women go through, families go through. And I knew I wanted there to be another option for women. And I kind of I lived in Cuba for 6 years, and while I was there, I got to see how they're an integrative approach to healthcare and how women kind of acupuncture is kind of just incorporated into traditional medicine. And I really, really loved that. Now, when I got back here, of course, that framework did not work as smoothly as I anticipated. So I started seeing acupuncture patients at an integrative school in Maryland, and it kind of has worked really, really well. Like, a lot of my patients are glad to have another option. They're glad to have another route to go that doesn't involve so many hormones. And the success rate, some are using them in conjunction with their traditional IVF or artificial reproductive technology. So it has kind of just been a match made in heaven, because I feel like I'm really being able to help a larger sect of women achieve their conception goals, but at the same time in a way that is more in line with what my goals are as a practitioner.
That's very cool, and I love that you did a lot of work internationally and then brought those insights back here.
Yeah.
So, I mean, I know a lot of people obviously in the US know or have at least heard of acupuncture, but even I myself, who I'm open to a lot of different things, have yet to try acupuncture. So can you, sort of in like a perfect world for you, how do you think it fits in, or do you think it fits in like whether or not somebody's even going through fertility treatment overall? Like, how does acupuncture just sort of weave into a woman's life?
In general, I think it helps you to flourish in a way that addresses mind, body, and spirit. And a lot of times that kind of sounds kind of very hokey, very new agey. And I myself, someone who hadn't experienced acupuncture at all until I actually got to Cuba, I was like, okay, if this is built into the system, I'm going to try it. I'm going to see how this works. And the first time I actually got acupuncture, I was in love. Like, I felt a whole new surge of energy coursing through my body in a way that I couldn't even articulate, to be honest. But I knew something was going on, and I was excited about it. I was like, I want everyone to feel this way. And I wasn't trying to get pregnant. I wasn't having any fertility challenges. I was 24. And it was great. And from then on, I started going to an acupuncturist as part of my own self-care and preventive care. I'm not a person who normally gets sick, but I just have to say, in terms of just my spiritual well-being, my emotional well-being, it's definitely been one of those things that helps to bridge the gap. Just in terms of just Chinese herbs, like all of the Eastern medicine kind of modalities have really helped kind of bridge the gap for me in terms of not just my professional life, but also my personal one. In terms of how it works, it's magic. I just have to say it's magic, and that it's all the channels that are invisible channels that are coursing through your veins. Acupuncture just does a really, really great job of stimulating the right place at the right time to help your blood move, to help your energy flow, and to stimulate anything that may be stagnant, to help loosen up all those, anything that could be just blocked, whether it be physical or emotional.
So if somebody, and again, we'll get to fertility, but just curious for baseline, acupuncture, if somebody is looking to find, an acupuncturist, because I know it's a very personal thing, like going to a doctor or going to a therapist, things like that. Are there any things that you could say somebody could look for when they're like first visiting an acupuncturist, or like maybe ask a question or two to make sure they're comfortable with that person?
Like any other practitioner, I have to say it's a matter of personal. I would first think about an acupuncturist that is in your area that you're going to be comfortable going to frequently. In terms of for self-care and maintenance, not necessarily on a multiple times a week basis, but given your condition, it could be multiple times a week. But once you have the geographical location, look for someone that you resonate with. Look for how they treat you as a person. Look for what experience they have with whatever it is that you are dealing with, whether that be from a Western medicine perspective or an Eastern medicine perspective, and how comfortable they are with the integration of the two. I work with medical doctors, I work with chiropractors, I work with acupuncturists, I work with Chinese herbalists, I work with naturopaths. And I think it's important to have all those members on your team, but it's also important to have a practitioner that is okay having all those members on your team and being a part of a team. And if you don't have a team, that's great. An acupuncturist can be great for preventive care and prevention, but at the same time, I think it's important to know that you need to be the one being comfortable with who you're going to, because that person is going to be, again, on your team. Mm-hmm. It's important to have that person on your team.
Very cool. So about fertility and, women's health, and of course egg freezing, because I know you and I have connected on the subject of egg freezing. Right. And I'm a proponent of talking about it and just making sure women know their options. Not that they necessarily have to do it one way or the other, but at least they're comfortable with the conversation. Right. So could you tell us your thoughts, on the subject, as well as just, we'll start there, subject of egg freezing.
I think it's an awesome idea. And putting back on my OB hat and my OB-GYN hat, I do bring that up at, when women come in for their appointments. We talk about where you are in not just in your life cycle in terms of getting your pap smear done, but where you are in terms of, do you want kids? Are you planning on having kids? This is important to you. Is this a factor that you're building the rest of your career around? And I have to be honest, most women in their 22, 23, 24 range, they're really just getting out of college and they're just trying to find a job. However, that is the best time to freeze your eggs. And most women are thinking that is something, starting a family is something they'll do when they're 28, 29, around that area. And it's not something that they're really thinking about. And even if they are thinking about it, because some of my patients have some, let's say, some kind of uterine challenge where they know that they need to they're going to have challenges later on, and they definitely need to make this an option. But then it's the cost factor. When you're 22, 23, 24, you're not rolling in the dough. You're not rolling in the dough. You're trying to just have a step up from surfing in your couch cushions to see if you can get, 5-cent wing night. So there's the expense that goes with that. So what I see more than anything is while it's important, it's not one of the main factors that women are thinking about at that prime age where egg freezing would be optimal. Because as you grow, as a woman grows older, the quality of her eggs also diminishes. And so freezing eggs is not going to be more encouraged as the woman gets older. The ideal time would be around that 22 to 25 range. Mm-hmm.
And so do you feel like, since you do see a lot of women now with fertility, treatments and things like that, that you're helping them with, do you think if they would have, maybe if this was 10 years prior, and obviously I know that the technology and things have changed recently, but do you think that some women may not be where they are today if they would have considered it?
Absolutely.
Earlier.
I mean, hands down, 100%. Mm-hmm. Women are in general, and I'm not saying every woman, but they're putting their career first, and they're trying to get financially steady. And along that career path, it takes the woman to at least, I would say, 29, 28, 32, around that age range to say, yes, I mean, I'm at a great point in my career. I'll start thinking about having a baby. And unfortunately, unless there's something crazy going on that's causing you to like really focus on your reproductive system, a woman doesn't really know that there's something going on unless there's already something going on. And sometimes the fact that there's nothing going on is a symptom of a problem that you have that you don't even know that you have. I mean, fibroids come along with their own set of symptoms. Polycystic ovaries come along with their own set of symptoms. But unless you're trying and can't get pregnant, you may not know that you will have a problem getting pregnant. So if every woman could freeze her eggs between 22 and 25, it would literally put the fertility business out of business. It really would, because there would be, I mean, we would still be able to, you know, use that in different ways, but in terms of actually having a hard time with the act of conceiving, it would pretty much be a done dita, because you have like a really, really good set of eggs, healthy eggs, great quality, and it would probably be not even a problem when you're 39, 40, or older, or even older.
So two questions for you. Do you think that I know there's like numbers and statistics are still coming together in terms of egg freezing, but do you think there's a general number that you would recommend women freezing to be like, okay, this is a nice set, like I think I'm good?
Yeah, that's a good, and I think that number ranges. And I think it also depends on what end of the spectrum you're freezing your eggs. If you're at that age range or between 22 to 25 where you're, a good 10 would probably be good, because they're healthy, they are at their optimal peak range, 10 would be good. And as you get older, as many as you can that are in good shape. But for me, 10 would be a sound number, and then it kind of gives you the flexibility to do what you want, when you want, how you want, with pretty much little or no worries.
Very cool. And then, because I know that you are well-versed in Eastern medicine, which I love, and just having traveled to Asia and really seeing their different treatments there, I think Western culture, you know, is adapting some of their traditional medicine, but we still have some ways to go. So do you think there's anything from like a women's health perspective that you would encourage women to maybe think about or incorporate into their well-being, or, you know, I don't want to say diet because that sounds like so rigid, but...
Yeah, well, if we use diet in the looser general sense of the word, in terms of not going on one, but actual what you take into your body. One, extreme diets of anything that's eliminating something, probably not the way to go. Eliminating carbs, or eliminating sugars, or eliminating, you know, dairy, or eliminating anything that's actually not necessary, like, or sugar, or bread, or even just I'm not eating meat. I think all those things, those extreme diet intake situations, are a leading factor. A lot of my patients have been or were vegetarians, and as soon as we infuse a little bit of bone broth, just that building their iron back up leads to like massive changes in their whole, you know, fertility journey. So that's a simple thing. And those are, I mean, in the big scheme of things, it's not a simple thing, especially if you've been a vegetarian or a vegan for a long time, to say, okay, now let's try to eat some meat. It's not easy, but in terms of infusing meat into your diet versus hormone injections, I mean, it's something that a woman could weigh. In terms, staying hydrated, that's important. And also, more importantly, is exercise and keep moving. A lot of things become stagnant as we're sitting down. We become stagnant, and so does your internal body environment become stagnant. And unfortunately, and also fortunately, we carry our stress, we carry our emotional issues in our uteruses, in our, you know, midsection. And when all that negative energy pulls there, that's where a lot of other infertility challenges may occur. But between staying active, staying moving, staying hydrated, those are the three things, and they're simple. But avoiding just extreme diets that may just not be the best thing, especially as one grows older, because when our bodies are younger, we can adapt, we can change, we can move and shake, and with little or no consequence. But especially as you get older, it's important to make sure that your body is functioning and firing on all cylinders. And the best way to do that is by what you're putting in it, and also making sure you're using all the good stuff in terms of movement.
So lots of good nuggets and facts here. Thank you so much. I did not think you were going to say that, or didn't know you would say that. I actually don't eat meat, so oh my god. I might have to think about that, because it's been about 6 years now. So
yeah, and in full disclosure, I was a vegetarian for 20 years, and after like reading, studying, and infusing, I was like, oh my goodness, I'm like doing the wrong things in terms of keeping my body in the best shape that it can be. And I felt great. But I also could definitely feel the shift when I've been eating meat, but I started off with just some bone broth, because I don't think I'm ready for that. And just the infusion of some bone broth has been amazing, and it tastes great.
Mm-hmm. Well, good, things to think about, and right.
And there's ways to do it for, it is bone, but you're drinking the broth. So I try to tell them it's not like you're chomping on a full steak or anything. So It's a great way to ease yourself or make the transition, because I personally didn't want to, but I said, and to conserve and preserve my fertility and my overall health, which I can definitely see changes in. I feel great. I have way more energy. It was something that I was willing to do before that, and it was an easy step. And plus, again, it tastes great, so it wasn't so much of a transition at all.
Yeah.
Hard one anyway.
And that's important, I think, to at least think about, because there are so many suggesting like diets now for people to cut things out or try different things, and really like the elimination diets are a thing. And so maybe it could be, not so great for some folks. So good to think about. Well, thank you so much for chatting with us today.
Thank you. I appreciate you. This has been great.
Oh, yeah. And question for you, since I know you're in the D.C. area, if anybody would want to see you in particular, is there a place that they can go to ask for your services or check you out?
Yes. Maryland University of Integrative Health, and that's in Laurel, Maryland. And you can just send me an email to make sure you see me, and that's lwhite, LWHITE, at muih.edu.
Perfect. And I will also provide that to a link as well to the site in the notes. Great.
Yes, that's wonderful.
Well, thank you so much, Dr. White. It's been a pleasure, and I hope to see you back soon.
And thanks so much, Radell. That was excellent being here. Thank you.
Bye.